Hello, everybody. It's Dr. David Brady here. I'm coming to you from my house, like most of you. I've been working from home and following all the social distancing and trying to just do my part. I know things have gotten very controversial, and and you're probably wondering, what should I do as things start opening up? And I can tell you I don't have all the answers. I'm not sure how this is going to unfold, but I do believe we have to start getting our society, our culture, and our economies going again. But we need to do this in a responsible way that doesn't cause more unnecessary deaths and overwhelm our hospital system once again. So I think we can do this smartly. So I would say, and follow your local guidelines as far as what your state and area are doing, because a lot of this is dependent on a specific region or area, how many cases they've had, what's going on with the medical delivery system and the capacity of the hospitals and so forth in your area. So, if you live in Manhattan, the story's a lot different than if you live in the middle of Montana or Idaho. That's just reality. But follow the guidelines. But as we start to open back up, I really think whenever you're in an area where there's lots of people and there are crowds, even though if everyone is trying to stay somewhat distant, I would still wear a mask. And I would be diligent about cleaning surfaces down. So I bring wipes with me when I go to the grocery store. I wear a mask. I even wear gloves and so forth. But I don't wear a mask when I'm alone driving my car. I know I see people doing that. I'm not sure that's really necessary. But just be careful. We're not sure what's going to happen. I'm sure there's going to be ongoing cases. There's going to be some reemergence as we come out of our shell. But, we, as a population, we need to develop herd immunity, and the antibody tests are showing that there's a lot more people who've been exposed to this virus and either had no symptoms, had mild symptoms, and recovered, which is actually good. It means that there's more immunity in our population. And that's what's got to happen. I mean, all the quarantining, social distancing, all of that was really a plan to just make things happen slower. It doesn't really change what happens. This type of virus is very transmissible. Over the course, it's probably going to be exposed to everybody, and our immune systems are going to have to deal with it. And we just want a hospital system that's not being overwhelmed by too many cases. But I don't think fundamentally it's going to change the ultimate outcome, which is that we're all going to get exposed. The vast majority of us are going to have an immune response that's going to be able to deal with this successfully. For those who are at risk, from those who have the genetics that unfortunately dictate that they will potentially go down a very acute path of respiratory distress and so forth, then we want to learn lessons from those who have been managed up to this point and have a healthcare system that's ready to deal with them very effectively and not running over capacity. So hopefully we have that wired now. Better therapeutics are coming. But I really think it's time to really double down on healthy lifestyles. Eat whole, fresh foods. Don't, in our sequestration, eat junk foods and foods of convenience that maybe you typically would not. This is a time that you really eat well. This is a time to reduce your stress, do some meditation or some guided imagery or just some prayer, some relaxation, anything like that to reduce stress. But I would really continue on a good supplement program, particularly things that keep our immune system really strong. Things like getting enough vitamin D, and right now I'm recommending my patients take at least 5,000 IUs a day. I have them taking vitamin C and quercetin. I have a powder called quercetin ascorbate powder that I have people do at least a full rounded teaspoon a day. This will help keep their cytokines quiet. It will help with their lung function, and it even is known to block viruses from attaching to cells and entering cells. We don't have exact data on SARS-CoV-2, but it makes sense that it might be helpful. I'm also recommending people take a little melatonin at night, even if they don't have problems sleeping, which it is most known for, but it has immunomodulatory benefits as well. And it can sabotage that cytokine storm kind of scenario that you've heard about. So about 3 milligrams at night of melatonin is just a general advice that I'm giving. And then I've put out some information before with some general immune supportive type of botanicals and other types of supplements. There's been some interesting information on microclotting and coagulation problems being caused by this virus. So, for those people who it's safe to do so and are not on any other anticoagulants or blood thinners, I have many of my patients on one baby aspirin a day. Some of them who don't want to take aspirin, we have taking things like nattokinase, serrapeptidase, lumbrokinase, and or fish oils. So those are all some things that I think you should potentially consider and talk with your provider if you have someone directly managing you, of course. And then stay on the lookout for more information on my website at drdavidbrady.com, on fibrofix.com, and mainly through my newsletters. So everyone, be safe, be healthy, be calm, and I think we're all going to get through this together. Summer is coming, and I think we're going to slowly get back to a normal life, and I hope you're all well. Thank you.